Hello, I'm Dr. Carly Polland, clinical lead at Biomesight. This video is a part of a series where I walk through how a practitioner would look at sample results. Before we dive in, I need to remind you that while I am a doctor, I am not your doctor. The information in this video is for educational purposes only and is not intended as medical advice. Please speak to your healthcare provider before making any changes to your healthcare. Now we are going to talk about a few well-researched beneficial species in the gut. Lactobacillus, Bifidobacteria, and Acromancia. So Lactobacillus species prevent pathogens from colonizing the gut, produce beneficial short-chain fatty acids, and maintain a healthy pH of the colon. Some species even produce neurotransmitters such as GABA and acetylcholine, and vitamins like B12. Bifidobacteria has many health benefits. They prevent pathogens from colonizing the gut, promote healing of the gut, modulate the immune system, produce vitamins, protect against insulin resistance, and more. Acromancia species are important for metabolic health. Their abundance is associated with lower body fat and better blood sugar balance. The presence of Acromancia indicates a healthy and diverse gut ecosystem. Now, these are bacteria that can be wiped out by antibiotic use or other types of antimicrobials like herbs, and particularly Bifidobacteria and Acromancia are going to be sensitive to antimicrobial type substances. So don't be surprised if your levels are 0%. If these bacteria are actually extinct, the only way to get them back is through a fecal transplant, and even that might not work. Probiotic supplements will not repopulate your gut. However, 0% on this stool test does not necessarily mean these bacteria are extinct. It may just mean these bacteria are so low they cannot be detected at this point in time. So I would recommend still working on feeding these bacteria, and you may see them pop up at low levels on your retest. I see this quite frequently when they first present as 0%. So to increase Lactobacillus and Bifidobacterium, fiber in your diet and prebiotics are going to be the tools of choice. In your diet, focus on resistant starches, and pretty much any prebiotic will support these bacteria. Now, Bifidobacterium can be a little trickier to boost, as we do want higher levels compared to the other two. It can require higher dosing of fiber and prebiotics to boost to adequate levels compared to the other bacteria. It will also more easily get knocked down with antibiotics or other antimicrobials. So I often find it is more difficult to boost Bifidobacterium in people who are exposed to antibiotics under the age of 6 months. So Bifidobacteria should be the dominant bacteria in the microbiome under the age of 6 months. But if antibiotics are used during that time, it will completely decimate the population of Bifidobacteria. So to increase Acromancia, minimizing saturated fat, increasing soluble fiber, and eating more polyphenol-rich foods can be very helpful. Intermittent fasting is also a good tool, and prebiotics like arabinogalactan, inulin, and glucomannan are also helpful. So if Acromancia is high, which I sometimes see, there may be a few things that are going on. First, Acromancia thrives on mucus. So elevated Acromancia may indicate more mucus in the stool, which can be from slow transit, so usually presenting as constipation, or inflammation in the gut. However, Acromancia does tend to cluster in the stool, so you may have also just hit an Acromancia cluster when sampling. So I tell all my patients to catch their entire stool and sample from 10 to 15 different spots on their stool instead of sampling from toilet paper to help avoid this issue. So if your Acromancia is high, consider resampling, or if you are experiencing some digestive symptoms, consider talking to your doctor about assessing for GI inflammation. So a stool calprotectin or lactoferrin is usually a good place to start to test for GI inflammation.